So there's been a lot of talk about upfront therapy across the last year, with the Determination trial being presented as a plenary at this year's ASCO and an oral presentation at this year's ASH about what upfront therapy ought to look like, especially as it relates to incorporation of autologous stem cell transplant. And what we tried to do was really look at it from a real-world perspective, because we recognize that there's a whole landscape of patients out there that may or may not have been included in these types of trials, and we want to figure out what's the applicability to the average clinician at the bedside. And what we found in the real-world setting is that only about 1 in 5 patients will receive autologous transplant up front, which we recognize, at least in the US, that this is fairly on par with what we've been seeing. Most patients are getting a VRD-like or VRD regimen. And what it actually turns out is that the real-world progression-free survival and the real-world overall survival is improved when we incorporate autologous stem cell transplant up front. Now, this is a little bit different from Determination. In Determination, they showed, yes, the PFS is improved with transplant, but overall survival has not yet changed, or there's no real difference yet. We're starting to see that in the real world, and actually this kind of translates across subgroups, including people who are a bit older, including people of African or African American descent, including people with renal dysfunction. So obviously we need to kind of put this all together between obviously a real-world study that's database-driven in partnership with a prospective trial that's been going on since 2009. But I think this still shows that there are people who do benefit from transplant. There are certainly people who get progression-free survival, and there are probably people who get an overall survival advantage as well. So I don't think we're quite ready to get rid of transplant despite all these great new drugs.